One important part about cortisol is that when it's really high and you're in the most stressful situations, even really stressful exercise situation, it dampens the testosterone response. And testosterone is a natural anti-inflammatory. It's a natural anti-anxiety, and it's a natural antidepressant. Mm-hmm. And so for men in particular, that cortisol to testosterone situation is pretty dicey.
Health, fitness, mindset, nutrition. Live better and longer. I'm Saad, and let's hone in. Tell me about inflammation. Why do you say you talk about it so much? Why am I hearing everyone talk about it so much?
So inflammation is, in my opinion, the leader of all chronic disease. Mm-hmm. And so it's the enemy or the scourge of the modern time. Inflammation is cytokine production in relationship to stress within the body, and it creates a cascade of events that eventually leads to turning on of chronic disease genes or creation of chronic disease. There's not a chronic disease in medicine I can think of that doesn't have inflammation at its core. Coronary artery disease, diabetes,
dementia, big one, right?
Dementia, absolutely. Alzheimer's type dementia as well. And so everything is related to this cytokine outpouring that happens in inflammation. And inflammation has lots of causes, lots of things that we didn't ever think about in the past. So we used to think about simple things like inflammation's caused from infection, inflammation's caused from certain foods, and certainly our diet is inflammatory. But we didn't think about it until recently how much the mind and body work together to create problems and benefits. And so stress within the mind creates inflammatory reaction within the body, inflammatory cytokine production. So just the very mental stress that we all live in every day, we have this fight or flight system, and we evolutionarily developed it to survive events like running from the tiger or running from the flood. And now we have it all day long. Like, oh, am I going to get across town to get my kid in time? Mm-hmm. I've got more work to do than I can get done. The financials are poor for the company I'm working for. We have all of this stress that never goes away. So evolutionarily, we would have had the tiger that either chased us or killed us, and we either survived or we didn't, and we'd go back to baseline. Mm-hmm. And we don't have that same situation anymore. So this chronic mental stress is really a problem, and that leads to another factor causing inflammation, which is lack of sleep. Mm-hmm. So we hit the reset button at night, the brain cools down, the brain begins to find its own anti-inflammatory mechanisms to heal, to assimilate memories, to store memories, and to heal the body. That's where the GI tract does the majority of its work. That's when we make a lot of our hormones, including testosterone. And so being anti-inflammatory means you have to get enough sleep. And having stress interrupts the sleep. Having PTSD interrupts the sleep. And so all of it leads to more inflammation. And it's like the hamster on the wheel, kind of feed forward.
So it's almost like the moment you become a soldier, you're in basic training, you're not sleeping the way you used to.
Right.
Then on top of it too, your cortisol levels are initially increased. Mm-hmm. Although you're in that prolonged period of fight or flight, so it never comes mm-hmm. down until you're completely burnt out.
Yeah.
And then on top of it, to make it worse, you are always being put into a place where you're not, I should say this differently, where you don't have certainty about what's going to happen
Correct.
Next in your life.
And that's a big deal, not knowing, especially with the way that modern warfare is conducted. You know, beginning with the Vietnam War, it became unknown. It wasn't troops marching against troops and storming battlefields and storming the beaches. It's guerrilla warfare. You don't know who the enemy is. You don't know the next minute if a child is going to pull a gun or if there's going to be a roadside bomb, and you don't even know what the enemy might look like in a situation. So the uncertainty every moment, even during sleep, if you're in a deployed situation, there is no relaxation.
So it's your body can't even heal itself mm-hmm. during the times it was evolutionary built to heal itself mm-hmm. anymore.
Absolutely. And one important part about cortisol is that when it's really high and you're in the most stressful situations, even really stressful exercise situation, it dampens the testosterone response. And testosterone is a natural anti-inflammatory. It's a natural anti-anxiety, and it's a natural antidepressant. Mm-hmm. And so for men in particular, that cortisol to testosterone situation is pretty dicey.
Now, someone once told me that, and I think it was actually, I take it back, I read it on PubMed, that military field training can decrease testosterone production by up to 47%. Is that a real number?
It's a real number, and it's in a snippet, though, that the big picture is that when they're in the field training directly, the T goes down. Most people do initial field training at the beginning of service experience, mm-hmm. so they're not in a position yet where they're entrained in the way we've talked about already. And so even if their T does rebound after the field training, Give me those same patients a year or two later after a deployment, combat experience, maybe a TBI, maybe PTSD, maybe the beginnings of service-related depression, all of which affect testosterone as well. So you're not able to put it in such an isolated fashion to just say that field experience decreases testosterone, which rebounds at the end of the field experience. But overall, just knowing that field training does that is pretty scary.
Is it enough to say that if when soldiers come back, we were to teach them deep breathing exercises, optimize their hormones, and tell them how to go to sleep better, that a lot of this gets fixed? Or is it a longer term problem that we don't even know how to, I would say, solve yet?
I think it's the latter, but the former is so important.
Mm-hmm.
Why wouldn't we do those things? Why wouldn't we try? Better research, less pharma-funded research that's more driven towards outcomes of particular patients like these soldiers, I think would make a big difference. But all of those things, teaching all of those things when soldiers return home would be nothing but beneficial, and there would be a do no harm approach there.
What do you think is holding us back from doing that? Because they're simple things, right?
Mm-hmm. Boy, that's a systemic question and a big question. I think there are so many things that hold us back. I think that kind of what I touched on earlier is that there is this certain almost expendability that once soldiers are back home, they kind of get plugged into the VA care, and the VA care isn't set up to do that. It's a really old system. It's an old system with old hospitals and older protocols, and it doesn't mean there aren't super talented providers there and well-intentioned people there. I've never seen people work so hard to help a population, but they're within a system that is out of date and underfunded.
Is it as simple as throwing more money at this?
No, because often the more money gets channeled down the wrong pathways. And so I think veterans need to be able to be more active in their healing. I think the behavioral health folks need to be more actively involved in finalizing kind of the debriefing when soldiers get home. You know, I know soldiers want to come home and see their families and go straight home, but having a bigger debriefing area and a better trained staff to do so that's heavy on the behavioral health and functional medicine side of things. You know, to my knowledge, the VA doesn't employ people that have functional medicine training.
Do you think though, one of the things that's really necessary in order to take on behavioral health is you have to be open and willing to step into it, right?
Yeah.
Like there is an element of it that feels a little bit woo-woo. And if you've probably been holding an M16 in your hand and throwing grenades across the bow.
You don't want to talk about your feelings.
Yeah, like how do you get someone to do those things?
Yeah. I think having a lot of background education prior, during, and after service to say, this is how disease happens. These are the things you're going to be at risk for. These are the exposures you're likely to have. And here's what they will do. It's just simply education. Because regardless of the bravado and the machismo that happens in the military, and some of it's ingrained, some of it's based on the person that chooses that career, but much of it can be encountered in a way that I just want to show you and teach you that this is something that will happen. Here's the physiology of how it happens. I've never met a patient I can't explain these topics to. And when the light bulb goes on, that's when they're able to help themselves get well and demand the care that allows them to be well.
What do you think that light bulb is in most people? I know it's different for different people, but if you had to say, like, these are the top 2 light bulbs that go off, what do you think they are?
I think it's talking about the fact, so this is something that's a big light bulb for my patients, is back to the inflammation topic. People aren't taught and don't know how much you truly are what you eat and how much sleep truly affects everything. Mm-hmm. So think about it. What can you go the shortest amount of time without dying? Water. What's the second thing you can go without for the shortest amount of time and not die? Sleep. It's not food. People can fast for long periods of time and maybe they wouldn't be healthy, but they won't die. Mm-hmm. And so you start losing your mental health very quickly. Less than 7 to 7.5 hours a night, after 3 or 4 days, you begin to get confused, your mood starts to swing, your inflammation goes up, you're not in the reset mode that sleep brings, and the downward cascade of health happens. And so just simply knowing that what you eat matters and what inflammation is, how do you create all of these cytokines that disrupt your body function by food, by ultra-processed food and inflammatory eating, adding artificial sweeteners to things that cause endocrine disruption, and what does that mean? And this is not a huge conversation. This is just opening the topic up to realize that what you do in your daily life with what you put in your body and how much you sleep creates disease. I can't imagine a human that wouldn't want to hear that, regardless of your attitude. And the light bulb comes on and you realize that it's not so simple. And I may have been not told these things.
I think that the biggest story that's yet to be told is the inflammation story. Like I think, and you nailed it before when you said connected to cardiovascular disease, endocrine disruption, dementia, et cetera, et cetera, et cetera, et cetera. I feel like we're just at the beginning of getting that story out there. But the reality is that it's almost hard to grasp, right? Because it means
It's nebulous.
so many things. It's so nebulous.
And it's everything. It's the entire body's response to the way that we live now. And here's a really disconcerting idea. This is worrisome on many levels. Once inflammation has epigenetically triggered genetics that are dormant, you can then pass them on to offspring. So imagine, veterans that have come home and began to father children at that point, and what they have had created within their body that can then be passed on. And this is a new concept. We didn't used to know things like this were possible. We've just mapped the genome, really recently. We've just learned about epigenetics relatively recently to that. And so it's all a brave new world of medicine. And I think we will look back on how barbarically we've done things in the future, in the very near future. And as you said, medical training is obsolete by the time it's complete. And that doesn't sit well with physicians in particular. And you have to say, I'm going to figure out a way to keep up. And by the time a white paper is published, there are 10 more that might add more to the topic, but it's going to take another 10 years for that information to make it into the training I would receive in medical school. So unless you're dedicating a portion of your career to keeping up and learning these concepts, you're going to be at odds with the truth of the information quickly.
I am hopeful, though, because I do, and I'm hopeful because of physicians like you that have basically said, it was wonderful what I trained previously and what I learned previously, but the reality is that the world is changing very rapidly, and I myself want to be healthy, so I'm incorporating a lot of these behaviors into my life. There's something else I want to touch on because it hit a nerve with me.
Okay.
I eat a lot of Splenda. I eat more than I probably should. And that's the way I get around satiating my sweet tooth. You said that artificial sweeteners cause endocrine disruptions. Talk to me about that.